Good afternoon, everybody. My name is Dr. Chris Bird. I'm here on behalf of the Coastal Bend COVID-19 Task Force, and we're here to give you the weekly update on the pandemic. Task Force has two primary objectives. The first is to address your concerns and questions about COVID-19, as well as enable evidence-based decision-making on behalf of our local leaders. There are several interventions that are taking place right now to combat the spread of COVID-19, primary of which is to have people get vaccinated with one of the COVID-19 vaccines. Right now there are two, the Moderna and the Pfizer vaccine. When it's your turn, you're encouraged to get vaccinated. Additional rules have been in place for a while. People are encouraged to stay at home if they can, especially if they're at elevated risk to contracting COVID-19 or haven't been vaccinated. Face coverings and social distancing are a statewide mandate right now, and recently we've been told that if you double mask, that it helps more than using a single mask, especially if you're using, say, a surgical mask or a cotton mask. If you combine those two together, they can be up to 92% effective in blocking the spread of COVID. You're encouraged to isolate when you're exposed or symptomatic if you haven't been vaccinated yet. And lastly, there's partial or all remote schooling depending upon the school that's taking place. And businesses are operating at 75% of capacity in most of the Coastal Bend, and bars are operating at 50% of capacity. And I want to remind everybody that at nuacesnose.com you can see the risk dashboard. This is updated daily to let you know what kind of risk level there is for contracting COVID, and we're in the red zone still of extreme risk of COVID being transmitted in public places. Okay, moving forward to our review of the total number of confirmed cases. In the Coastal Bend, we're at 39,832 total confirmed cases with 36,168 recoveries. This week, I have some good news, which is that the active cases are down again for the second week in a row. This time they're down 14% over our report last week, with 2,595 active cases that are confirmed and documented. I want to remind everybody that there are more actual active infections than this, because not everybody that's infected with COVID gets tested, and so we don't know about all the positive cases. This is our updated transmission rate estimation, and transmission rate, again, is the number of people that somebody infected with COVID transmits COVID to. If the number is above 1, then COVID is spreading, and if it's below 1, then COVID is receding. And right now we have two projections. Both of them are below 1. They're both equally likely given our data right now, and they suggest that the transmission rate is between 0.81 and 0.92. And so what this means is that about 1 to 2 in every 10 people that contract COVID don't pass it on to the next person. And so that will result ultimately in a decline of COVID. And right now, COVID's declining in the Coastal Bend area. Here are the new confirmed cases. Each day, the daily new confirmed cases, the black dots represent that. You can see there's a distinct downward trend occurring here. And our projections from the model put through there with our upper and lower bounds on that. So regardless whether it's our upper or lower projection, again, the number of cases per day is expected to continue to decline for the foreseeable future. Zooming in on particular Coastal Bend counties, for Nueces County, you can see a distinct downwards trend, and for the other counties, which you can see down here, and I'll zoom in on them, they also mostly show a distinct downwards trend in the number of new cases per day. And so we're moving in the right direction here. Zooming out to the metro areas of southern Texas, all of them are either at a peak or decreasing at this point. So again, a pattern of decline of COVID. And if we zoom out to the whole state, these are the public health regions for the state. Again, all the public health regions are declining in terms of new COVID cases per day. And in this case, it's new cases per capita, or per 100,000 people. So COVID's decreasing across Texas right now. Moving on to hospitalizations, not only are the cases declining, but the hospitalizations are declining also. This data is for the Coastal Bend, and the black dots represent the actual number of people in the hospital each day in the Coastal Bend with COVID. If you're in the hospital for 2 days in a row, you'll be counted on each of those 2 days. That's the way that this data works. And you can see that the census number of people with COVID in the hospitals is on the decline. You can again see our projections here with the upper and lower projection indicating that we expect the number of patients that are hospitalized due to COVID to continue declining. The percentage of staffed hospital beds that have COVID patients in them is at 11.4% right now and declining. The reason why this statistic is particularly important is because it's used by the state and by the counties to determine whether to trigger rollbacks in the occupancy of businesses. If this number goes above 15 for 7 days in a row, then businesses will likely roll back to 50% occupancy. But right now you can see that we don't foresee that occurring in the near future. For the ICU, and this graph shows in red the number of patients in the ICU with COVID, and in blue the number of people in the ICU that don't have COVID, for a total of 185 patients right now in the Coastal Bend in the ICU, with 138 that don't have COVID and 47 that do have COVID. You can see that this number's been declining over the past week and a half, and we're expecting that this will continue to decline. So that's a positive outlook. While we are still pretty high, we want to see these numbers continue to decline. And I want to remind you that this metric is a pretty good estimate of the amount of pressure that's being exerted on the ICU and its staff by COVID. You can see that back in the summer, we had a high degree of pressure where there were more COVID patients than normally there are ICU patients in general. So that's a high degree of disruption of the ICU by COVID. Right now, we have a fair amount of pressure on the ICU, but not nearly as much as in the summer, and it's declining. So things look like they're going to get a little better here. This is a similar plot, but for the whole state, broken down by trauma service area. The Coastal Bend is right here, and it's only for 1 day, February 10th, which is a couple days ago now, but that's the newest day that I have in the data that we receive from the Texas DSHS. And so the way to look at this is you look at how much red versus blue there is. The more red, the more pressure on the ICU, and those are COVID positive patients in the ICU. So Lufkin, Laredo, and Victoria have fairly high loads in the ICU due to COVID, whereas most of the rest of the state has a much lower load of COVID in their ICU, allowing people without COVID to receive the intensive care that they need. This is just like the previous figure, except it covers every day from June to present. And so you can see the trends. And the trend that you'll see when you look across these different panels is that the number of patients in the ICU with COVID is declining in almost every trauma service area across the state. Moving on to fatalities, we're right at about the peak or just past the peak of the new fatalities occurring each day due to COVID, and we expect that these will begin declining. We have our upper and lower projections for how the mean number of fatalities per day due to COVID is expected to change in the near future. And again, it looks like we're on the decline. Overall, we've had 1,069 people in the Coastal Bend that have been recorded by the state as dying due to COVID-19, and 672 people in Nueces. I want to remind everybody that This number for Nueces is coming to me from the state, so it's a little bit behind what you'll see at cctexas.com, where you'll probably see a slightly higher number than this. And again, these cases are coming from counting death certificates. So death certificates get sent to the state counts them up, and there's about a 14-day delay. So while you see a pattern of leveling off here, that's because the death certificates haven't been counted yet, and not because the number of deaths has leveled out due to COVID. Moving on, getting into the proportion of our population, or the percentage of our population that's been vaccinated. This figure is for the Coastal Bend, and we have each county in the Coastal Bend and the percentage of people, or the percentage of the population that have been fully vaccinated, which means that the states recorded them as having had both doses of the vaccine. And you can see Nueces right now, we're a little above 3%, approaching 4%. And for other parts of the Coastal Bend, you can go a little bit higher or a little bit below that in terms of what proportion have been vaccinated. I'm going to zoom out a little bit and look at the whole state. And if you want to pause this slide and inspect it later, feel free to. But right here is us in the Coastal Bend, where this is the proportion or percentage of the population that have had at least one vaccine dose or 2 doses. So 1 or 2 doses are represented here. And we're at 9% in the Coastal Bend, according to the state's records. And if you compare us to other trauma service areas, which are in different regions of Texas, you can see that we're right about in the middle, with some trauma service areas having a lower proportion of their population with at least 1 vaccine dose, and others with a slightly higher proportion. Based upon our Q&A session earlier today at noon with the public health director, there were a lot of people that received their second doses yesterday in the Coastal Bend that I don't think are showing up in this data set yet. So we expect this number is going to continue to increase, and probably by next week we'll be well above 10%. Right, in summary, the transmission rate is below 1, which means COVID's declining, and this fall-winter outbreak is subsiding. New cases are declining, hospitalizations are declining, and fatalities are right about at their peak, and they're expected to decline moving forward. Now, while this is good news, I think it's really important that everybody realize that we need to stay vigilant. You're encouraged to get vaccinated if you can, for sure. Second, whether you have or have not been vaccinated, it's really important to continue wearing face coverings and social distancing. If you've been vaccinated, the reason why you want to continue to wear a face covering is that you don't want to get exposed to COVID and kind of become a petri dish that's trying to find that variant of COVID that can resist the vaccine. So we don't want that happening. So the less COVID you come in contact with, the better. The less COVID will evolve if you've already been vaccinated. If you haven't been vaccinated, there's obvious reasons why we want you to wear face coverings and social distance. And remember that you're encouraged to double mask, wear 1 cotton mask and 1 surgical mask. If you don't have a surgical mask and a cotton mask, then double up on either one of those. And again, multi-household celebrations are discouraged right now. And what we want to do is try to get COVID to recede substantially more than it is now. We're on the right track. We'd like it to decline faster and more. So if you keep doing these things, COVID will keep moving in the direction that we want it to, which is down. All right, I want to thank you very much for tuning in, and we'll update you during the week if there's any major developments on our social media accounts on Facebook, Twitter, and Instagram. Our handle is at CBCovid. Otherwise, we have our weekly Q&A session on Fridays at noon. So if you have any questions or concerns that you'd like to see addressed, you can post them to these accounts and any one of them, and they'll make it into our queue of questions, and we'll address those live, either myself or the public health director, Annette Rodriguez. And otherwise, we'll see you next Friday. I hope everybody has a good weekend, stay warm, and have a good afternoon.